Right. And live.
Hi, I'm Dave Gold. I'm here today with my partner, Justin Minot and Magnolia, and also my friend and physician, Dr. Jerry O'Donnell, who is here today to talk about news from the Corona front from a physician's point of view. Before we start, I just want to say that Jerry is the first person I called when I was coming back from flying to get advice. So I eat my own cooking in terms of trusting his judgment and his wisdom. And it just was coincidental that when I called him, Jerry was at a conference of about how many physicians, Jerry?
There was probably about 250.
Yeah, physicians in Orlando, which was kind of ironic because, well, you should probably tell the ironic part of that story.
Which was that the conference was last weekend.
Exactly.
In Orlando.
Right.
Everything started happening.
Right.
Well,
And
at least you missed the spring break portion right now. I heard that.
Yeah, we anticipated that. That's exactly right.
And so it was kind of interesting with you down there, Jerry, because I was asking you for kind of, latest that was coming out of this collection of physicians. And we've also spoken, I think, just a couple of days ago, getting your advice as well. So I realize we don't expect you to be the fortune teller or the burning bush here, but I think whatever you can provide at this moment, today is Saturday, March 21st, would be really helpful. So the floor is yours.
I would assume you guys want to speak about the coronavirus and the COVID-19. First of all, do we know the difference between corona and COVID?
I do not. Go ahead.
We will soon. So go ahead.
Just getting some terms down here. The corona is the name of the virus, and COVID-19 is the name of the disease. It's much like back in the 80s when we had the HIV and the AIDS. Okay, HIV was the name of the virus. AIDS is the name of the disease. Right now we have the coronavirus, and COVID-19 is the disease caused by the coronavirus.
Okay. And in terms of just understanding and sorting through the news and whatnot, is what should we keep in mind when seeing those two terms used more or less interchangeably?
Well, I guess in the office, what happens is people will generally come in with, upper respiratory symptoms, cough, runny nose, plus or minus fever, increased congestion. And from this trilogy of symptoms, you kind of have to sort things out to see if they are actually a candidate to get the test for the coronavirus. Not everybody obviously is. In fact, there's very few people who actually are.
So what do we need to do to make the cut? Does someone need to do to make the cut in order to prevent enough constellation of symptoms to justify testing?
I think the big thing is you've got to have a fever.
Okay.
You've got to have persistent symptoms plus the fever. Okay. And once you have the fever, then you could certainly be a candidate for the test, which is now relatively readily available, the RNA polymerase test, which we get results within 72 hours from the test.
Right. Now, where are we in terms of the overall trajectory of this virus in the United States specifically? Could you speak to that context? Because it, is hitting China. We're hearing a lot of news about Italy. What is the state of the union here in the U.S.?
I think we're probably pretty early on. Certainly, this is a pandemic, which is opposed to an epidemic. Okay, a pandemic is something which is multinational and has spread across many nations, whereas something which we term an epidemic usually doesn't go outside of one geographic distribution. So again, we have an pandemic, and it has spread to the United States. I think we are very early on, and I think that the track that the government is taking now is probably very appropriate with the social distancing, the isolation, everybody staying home, the washing of the hands.
Yeah. So when you mentioned before about being a candidate for testing, that the fever is kind of that's the deciding factor. In terms of our listeners, our viewers, knowing whether or not it justifies going in to see a physician, what is that the fever? Is it the fever again that you would say if you don't have it, don't come. If you do have it, do come?
Yes, I think that's, the fever and the cough are definitely the two symptoms that you need to be treated. But, right now, this, of course, seems, this is the perfect storm. We've got allergy season starting.
Right.
We
Got lots of pollen here in North Carolina.
Exactly right. We're in the middle of flu season. And then on top of this, we have all the symptoms from the coronavirus. Yeah.
Wow.
We're right in the middle of it.
Okay.
So when you say in the middle of it, just based upon past history, do you have a sense of like just said, the trajectory in terms of what we can expect timeline, or is that still just too speculative?
I think timeline at this point, Dave, is just way too early.
Okay.
Definitely by the end of March, I think we should be getting, some better data to suggest where we are on the curve.
Sure. But it's still way too early to tell.
I think it's way too early.
Mm-hmm.
So if since we have a platform here, are there one or two or three things that you wish all your patients and prospective patients would know? Do's or don'ts, anything at all?
Obviously, what everybody is talking about is, good hygiene, personal hygiene in terms of washing your hands to keep the social distance. I think it's like 6 feet, what everybody is trying to, herald now as the appropriate social distancing. Not gather in large groups. And if you are sick and if you have any of those symptoms, the cough, the fever, the upper respiratory congestion, just stay away from crowds.
Yeah. Yeah.
So I asked you this question a couple nights ago when I was getting your advice on a family situation, is how do you stay safe? How do you who have to be in contact with people and sick people, what do you do?
Dave, we talked earlier, and I actually thought about that after we had briefly discussed that. You really have to depend upon a good staff. You've got to depend upon a good intake person in the office, in the emergency room. You have to depend upon good nursing staff to, point you in the right direction in terms of this may be, we are highly suspect that this person may have the coronavirus. So you really depend upon your staff to kind of triage people and, point you in the right direction. I have not, as of yet, had anything other than mask, gloves, and a gown. We haven't used any, PPD yet.
Okay.
And one more question. I just realized, what's the treatment? I hear so much about not getting it. What happened? What's the course of treatment?
Just recently, within the past 24 to 48 hours, there's been a lot of discussion concerning the treatment with 2 drugs, which are readily available, and one being Plaquenil, which we use with people with rheumatoid arthritis, has been out since the 30s, and another drug is azithromycin, which is very common with the Z-Pack. It's what we call the Z-Pack. Both of these drugs, when used together, show some promising results, actually very promising results. I looked at that data last night. The data is on few people in Europe. I mean, few people, it's not a mega trial. I think the data was limited to 40 people.
Mm-hmm.
But the results were actually impressive when both are used together. Okay. And again, the drugs are readily available. The side effect profile of both of those are pretty minimal.
Okay. And those are not prophylactic. They're just after the fact. They don't actually minimize the risk of getting it.
Good question, Dave. That's actually a very good question. We're so early on in this whole disease.
Yeah.
You can imagine 3 months ago we were getting ready for the holidays, and now all of a sudden we are talking about treatment of a novel virus.
Sure.
The data now is used. We're looking at the data on people who have been infected. Yes.
Okay.
Whether or not you can take these empirically or prophylactically, there's nothing out there on that yet.
Okay.
Okay.
And last question. I think we're getting close to time here, and I appreciate. And I know, I mean, with Jerry, it's either we did it here or 10 o'clock at night, and I just so appreciate you taking 10 minutes on a Saturday to do this. Just where are we on a vaccine? Anything you tell us about a vaccine?
I think there's a lot of wheels in motion for a vaccine. I don't think we're going to appreciate anything. I've heard there's been some test doses given to people in Seattle. Right here in North Carolina, Duke is working on a vaccine in collaboration with several other agencies. I think we're probably several weeks away from a vaccine.
So is this one of those situations where we get the vaccine by the time it's, all the way done? Or
I hope not.
Right, okay.
I certainly hope that's not the case.
Okay, I got it. Dr. Jerry, thank you so much. And we'll definitely get you back on so we can have some periodic updates and track this thing as it progresses, because our listeners are going to benefit big time from your wisdom. So thank you.
And I just also appreciate, Jerry, I know that you just can only tell us what you know. I mean, and I know I tried to get more out of you than you can actually comfortably give me. But I appreciate your forthrightness and also just your humanity. You're a great guy and a great doc. Thanks a lot.
Absolutely. Thanks for having me, guys. Have a good day.
You too.